Hi everyone, this is Dr. Neal Schwartz. I want to try something different today and take you guys through a case to see exactly what I've been witnessing for the past several years. To start off, this is obviously a severe case of acne. She's had this for 10 years. To start off, let's take you through the chart and I'll show you some of the questions and some of the history I gathered from her when we first began. Here's a photo of her chart. Let's go through a couple details here. She's 21 years old. I asked her how long she had acne. She said 10 years. And right off the bat, I recommended Accutane to her, and she refused. The reason I recommended Accutane to her is because she has a serious, severe case of acne, and not because I think she needs Accutane, but because until this project gets more well known around physicians and the medical community and becomes the standard of medical treatment, this is just being defensive and really telling all my patients what's out there and giving them all options. She told me specifically she did not want Accutane, so I didn't refer her to someone who prescribes Accutane all the time. I myself, as a family practitioner, have never prescribed Accutane, and fortunately, I'll never need to, and that's what this project's all about. So this is just, I thought it was an interesting point that I had written this, that I saw her case, was concerned about her, and told her about Accutane in case she didn't already know about it. Here's another section of the chart. I asked her what she had tried. She had been to the dermatologist. She had tried Proactive. She had tried over-the-counter medications. I said which one. She said all of them, assuming she's tried many of them. As many of you who've been to the dermatologist, she got prescription topicals, multiple, and she had tried oral antibiotics, which is also a common treatment at the doctor's office. And I put here also she refused Accutane. We're going to go through her case now and show you some progress after several weeks in between photos. I'd recommend, if you haven't already, enlarge this video to the full screen. In the lower right corner you'll see the expand button. These videos are much more dramatic when you really get in there and look closely. Alright, so that's her history. So here we are at day one again. And I want to show you some of the aspects of her skin and what she's suffering from here. You can see the blatant oil in her nose here, and these pores on her nose are plugged up. Down the crease of her nose is very thickened and oily. Here you can see the oil, and you can see many marks and bumps and extreme activity. We counted over 300 bumps here. Take a look at all this activity along the jawline, and the chin was very active and painful. This inflammation is obviously not comfortable. About 3 weeks in, this is a shot from 3 weeks in, you can see she still has a lot of activity, but it's all calmed down quite a bit. The bumps are smaller and things are a little more red, but that's more of the wounds that are red. I don't see any very red new bumps. Every bump here seems to be old. You can see here these are smaller, but they're still there. Check out a couple weeks later. You can see now on the chin, those are no longer bumps. Now we're just wound healing again. And you can see through here, these are all wounds that are healing. We're not seeing acne anymore, we're seeing wounds. Just like if you were to go through the windshield of a car or have any other trauma, these wounds are now healing. But this is almost, we see one bump there, we see one bump there. This is almost inactivated from having 300 bumps here before already. This is in a couple months, maybe 2 months here. This is another couple weeks later. We still have some old ones that are stuck in there, but you can see some of the wounds are starting to heal and the redness is coming down. This chin is starting to look normal. And she's definitely happy here and beginning to heal. Look at the nose, is much less oily. These creases here are not full of oil. This is nice. This is today's shot of a progress report. We have one old bump that's just stubborn and sitting there, but if you look at the chin area, this is completely inactivated, and you can see all these scars and marks are fading nicely. Her nose is free of the blackheads. This area has smoothed out and has some residual thickening from years of having thick skin there, but that can also be worked. This is just a progress report. This skin right here used to be very oily. Let's take a look again at day one compared to this shot. So you can see this is a dramatic improvement in the texture in here, Of course, the bumps, look how thick it's bumpy in here compared to what we were just looking at. It's just completely inactivated. And this chin area is completely inactivated. Let's look at that again. It's unbelievable. You can tell her life is obviously completely changed after having gone through this program. She's happy, you know. This is what it takes sometimes. Let's take another look. Let's go through some of the details. Look at the chin area here. Look how active this chin is. There's dozens of little bumps, a lot of big ones. You have this texture around the mouth that looks uncomfortable. And let's go back. It's just completely different skin. And we did this without any oral medications. Feel free to show this result to your doctor if anyone ever tells you oral medications are the only way to combat severe acne. This patient happened to refuse Accutane, and so we did it another way. There's more than one way to beat a tough medical condition. Let's see the other side. This is, again, obviously severe acne. We counted a total of 300 bumps. Look how much activity here. We got small bumps, medium bumps, thick bumps. We have this film of thickened skin here. You have the oily, plugged blackheads on the nose, the crease, and the oil up in this upper cheek area is just so obvious. The bumps are obvious. The red bumps that are dying are still very, very blatant here.